Hello everyone, I'm Dr. Shammai Rockove from the Center for Men's and Women's Urology in Portland, Oregon. I appreciate the questions that continue to be sent our way. So though I appreciate all the questions that are sent in, some of them really are very unique and pertain to a small group of people. And therefore I'm tending to take the questions that may be relevant to more people. In other words, with the sort of problems that tend to affect more people. But I don't mean to be ignoring the other questions. I'm sure over the course of time I'll be able to address them. But again, please continue to send those questions in. On that note, this was a question I received this week. Dear Dr. Rockove, thanks for sharing your ideas and perspective with us. I do have a question though, and maybe you can use it for your video series. I sure seem to be getting up at night and urinating more often than I used to. I'm 43 and female, and the frequency has definitely gone up at night, even if I don't drink much or anything the night before. Any suggestions or idea? Maybe I'm just getting old. Thanks for asking that question, and it's an excellent question because it is a very common issue. The problem of waking up at night to urinate is referred to nocturia, N-O-C-T-U-R-I-A. And there are a couple of things that tend to happen as we begin to get a little bit older. And one of the issues is that our bodies begin to withhold fluid that we ingest during the course of the day when we're standing up. But when we go to sleep at night and we lie flat, gravity no longer is really pulling at us in a dependent fashion, and all that fluid gets absorbed, gets to our kidney, makes the urine, and that's why we have to get up and urinate. There are other issues that are happening during the course of the evening as well. Some of the hormonal changes that occur with aging are playing a role, and there are hormones that have their effect on the kidney, which also continues to allow the kidney sometimes to make more urine in the evening than it actually does during the course of the day. What we try to do is take a stepwise approach to this. One is we just try to identify exactly how much fluid you're ingesting during the course of the day and over what time span. And I think one thing that's really good that you can do is keep a diary. Write down everything you drink and how much you drink, and try to get an idea and measure the amount of urine that you make. You can just take a measuring cup, urinate into it, and immediately flush it down the toilet. But you really want to get have the ability to compare your intake to your output. They should be fairly equivalent, and if they're not, then we can start to ask the question, why is that? If you do this measurement and you notice that what you're ingesting is about what you're eliminating, then things are normal. Then you can start breaking down into when you're ingesting that fluid. And you did point out that you don't think that you're drinking as much at night, but it's really worth taking a look at it and see whether or not you're drinking more fluids as the day progresses than you optimally should. And if you're urinating more towards the evening, you want to be shifting your fluid intake earlier in the day or evening so that you can eliminate it before you go to sleep. Ultimately, though, if this becomes more of a problem, we have to do more detailed evaluation. We do have to look for medical problems that can cause this sort of issue. There are hormonal problems, there are endocrine problems, and if the problem was a little bit more severe, even issues such as diabetes sometimes can play a role. I don't mean to scare you from the sound of your question. This sounds to be more of the typical slight changes that occur with aging. But it's worth looking into. If you can't come to the answer yourself and it bothers you, it's worth going to a professional to get a little bit more information. In the future, I'm going to do some videos on problems revolving around daytime urgency and frequency that has some overlap with the nocturia, but is a topic all of its own. I hope that gives you a little bit of insight. Feel free to send more questions through our portals and links. And I again encourage anybody out there who has urologic questions to send them our way, and I'll see if I can answer them for you. I'm Dr. Shammai Rockove from the Center for Men's and Women's Urology. Have a good rest of the day.